My third speech is on blood clots, and it's reported from the American Heart Association that 2 million people annually will be affected from a deep vein thrombosis here in the United States. And with that, 300,000 of those 2 million people will be affected by a pulmonary embolism. I have personal experience with that. I was diagnosed with a DVT and bilaterally both lungs pulmonary embolisms back in December, hospitalized for 3 days. So I do have a little information, and actually this project assignment gave me a little bit more wanting to learn about the blood clots. And blood clotting is basically a normal complex process that the body does to prevent excessive bleeding. It's more so when the blood vessel gets injured is when abnormal things start to happen and there starts to develop clots. Clots can develop in the arteries, which can then travel on and cause strokes and also TIAs, which is a transient ischemic accident. But I am basically going to be talking about clots in the veins, and those are normally found in the lower legs, or even arms, abdomen, or even the pelvic area, and they're called deep vein thrombosis. They're more known to be in the deeper veins than superficially. Those veins don't really cause a lot of damage or a lot of problems. Some of the reasons, the causes that could develop a clot is that the flow of the blood in the vein is slowed down. There's damage, or a person could even have a clotting disorder. Some of the risks for blood clots is immobility, being paralyzed, being hospitalized, or just even prolonged bed rest. Also having increased estrogen in your body, being on birth control. That's really, a lot of people are talking about that these days. A lot of women are coming down with blood clots from birth control. There's even a lawsuit out from Yaz Birth Control. Women are suing them. Also, pregnant women are prone to get blood clots, usually about 6 weeks or after having their child. Surgery, having cast on their leg or on their extremity, or any kind of surgery, and even having some medical conditions like lupus or rheumatoid arthritis, heart failure, can increase the risk for a clot. Cigarette smoking, having cancer, doing chemo for cancer can also increase the risk for a clot, and also any clotting disorder. I, in the hospital, got diagnosed with a gene mutation for prothrombin, so my I have a clotting factor, so that increases my risk. Some of the symptoms of a DVT is you can have pain, swelling, redness in the area, or even kind of a discoloration in the area. Pulmonary embolism, which is basically a clot that has broken off from the main clot down in the leg, and it travels to the lungs. You could have shortness of breath, chest pain, coughing, and coughing up blood. Some of the tests that I did have done in the hospital were a D-dimer. That's a blood test. And when it comes up negative, that's good. But if it's positive, the doctor said they have to go searching, finding out the real reason why it's elevated. It really could be many different things that could elevate the D-dimer. I had a Doppler ultrasound done on my legs, and basically it's painless, and it has sound waves, and it generates pictures showing basically if there's any clots to be seen in these veins. I also had a CAT scan done, and it's a combination of x-rays taken from many different angles. I had a contrast dye that was injected into my vein, so they were able to view the areas more readily, more easily available for them to see. And treatment, you can, I was diagnosed at the time with the blood clots. I was immediately put on heparin, and that was via IV. I was on that for 3 days, and when it was time for discharge, going home, I had the choice to go being put on Coumadin, which is very inexpensive, but there's a lot of lab testing and a lot of you have to watch your diet, can't eat leafy vegetables, or I went on another anticoagulant, which is a blood thinner called Xarelto. Yes, there was no lab testing, and I didn't have to watch my diet, but basically I had to worry about money issues. It is very expensive. Hopefully I will only be on this until June, so right now out of pocket it's costing me, with 2 insurances, primary and a secondary, over $700 for a 90-day supply. If you want to get some more information about this, about blood clots, DVTs, and pulmonary embolisms, you can go to the National Blood Clot Alliance at stoptheclot.org or even clotcare.com. This month right here is National Blood Clot Month, so hence me wearing the red, outfit. So hopefully you'll be able to find some more information from this video and get you a little bit educated about this disease. Thank you.
Keep it going. You got to show cards.
Do I have to show? Does
Okay.
it show them up close?
Yeah, it shows them good enough. All right.
Thank you.